Hi, Johnson Haygood here. I'm pleased to be here with Dr. Iñaki Gamborena from Spain, who is lecturing to us today, and we have a few questions that he's going to answer for us. Dr. Gamborena, thank you for joining me. Thank you so much. And we want to know what you see as far as the future of those of us providing cosmetic/aesthetic procedures to our patients. You know, we've enjoyed many years before of patients wanting elective procedures that we're not seeing as much of that, and we wonder what you would have to say about the future for those of us who want to provide these type of procedures in the future.
What do you mean by selective veneers?
Anything that would be considered aesthetic improvement of people's smiles.
So you don't see as much because
so
of the
we're
crisis.
not seeing, overall, we're not seeing as much in our country, and we're also interested in your perspective coming from another country, you know, how that relates to, you know, how our country is compared to others, but what you see for the future of providing, and what are the challenges and what are the opportunities that you see in the future?
Well, I guess we are in the same way in Europe, especially Spain.
Yeah.
We are having major problems with economics, and we still see the same trend as in the States, that people don't maybe spend so much money in their mouth as they used to. But in a sense, I guess, you know, coming from the European, even though I've been trained in the States, and I owe pretty much where I am today because of my American education. I really have seen the American dentistry like a little bit too much aggressive, on a sense that we were cutting the teeth too fast and too wild, compared to the European style, where maybe we are more conservative in the approach of restoring cases with maybe composite or mixture of composite and bleaching rather than veneers. It's true that it has been a great evolution in that aspect of doing veneers, because we mainly do invasive, prepless type of veneers, even though it's not easy to do. Right. It's really difficult. I'm the one that I think it should be prepped always in order to have a nice position of the veneer.
As compared to prepless?
Yes,
right.
As compared to prepless. But it's true that I always saw that every time that I was coming to the States, I saw a little bit too much aggressiveness. I guess the one that really, because my philosophy is that there is no material today in dentistry that matches up the enamel of the tooth. There's none. You compare. You want to be. From
the looks of your slides, I think they do, but I appreciate what you're saying.
We can be close, but we have a problem of metamerism. So we do beautiful things, but if we see it in different lights, being dentist and with a sharp trained eye, you can always tell. But it's true, we have evolved a lot. I think the crisis only benefits the patient, not the pocket of the dentist, that's for sure. Because what I believe is, from what I have learned, the less you touch the tooth, the better you will be. No? So maybe those people that are thinking that maybe having a white smile will open new markets for them, maybe it's better to have your own teeth untouched.
Right.
And they will last longer. No? This is a philosophical type of, but we see the same problems in my practice too. I place 25% less implants than I used to, but in my structure, it really helped me, because you know my office was eating me. I had too much work. So
too busy.
Too busy. So
is that where the opportunity is? Do you see an opportunity because of the current situation? What's the opportunity?
The opportunity is into education. Is into providing a quality service rather than quantity. I think this is the one of the best things. It would be even to increase your prices and to differentiate yourself from your competitors, no? Because coming back, I don't know in the States how it is, because you have a really high range of education, but in Spain, the dentist that comes out, first of all, they don't have enough money to really, they cannot get it from the bank either, to really start a huge infrastructure. Even though you have one chair, it's difficult for them to start, because besides that, they don't have the knowledge. So right. I think education is the issue, no? Is trying, is the only way that you will have patients
continuing your education. Yeah.
And it is something that in the state has been really well planned, really well established, and the dentists are in a continuing education.
You're seeing that?
Yeah, I see that.
How about compared to other countries?
It's not as easy. I see, what I have seen always is that American dentists spend more money on continuing education than Europeans ones.
Interesting.
Yes.
Because actually the average dentist in our country, according to Frank Spears, spends $900 a year. But you're not seeing the average dentist when you go.
Even in Spain, not even in Spain, they can. Some right. of them can spend that money.
Yeah, thank you. Next question is: what do you feel is maybe one of the hottest? We call it the hottest new thing. Maybe the thing that you're most excited about, either a new technology or a new something in our field that you're most excited about. Is there anything that really comes to mind right away?
I think maybe one of the biggest excitement has been the CAD/CAM as far as restorative, and as far as also the treatment plan of CT scans, where you can design the placement of your implant based on where the teeth would be. For the surgical aspect, I want to talk a little bit. The previous diagnosis through cone-beams, and being able to see it on a software and see where the teeth should go and where the tooth is, and see which are the options to really get to this type of result. This has been a tremendous improvement.
That's exactly the same answer that Bob Winter gave me yesterday.
Yes, this is maybe one of the best issues, because this provides also which options you will face the case, which type of design as far as surgical approach, is it viable, is it not? You can measure it, you can see it. You can also create 3D stereolithographic models of the situation, so you can study it in advance of doing it. So this has been an increasing diagnostic tool that really has improved tremendously what we do. The other issue is maybe the new materials, be able to mill things rather than, I think one of the biggest improvement has been in the laboratory, being able to avoid the casting and doing.
So fit is getting better.
Fit has been improved tremendously. So what I'm striving for is for new biology, technology, replacing tissue or extracting from your blood, be able to do your own tissue. I think dentists should ask for companies. Today we do it on burn people, where you can create tissue for the burning people to do graftings on them of epithelium.
So you see that being applied to dentistry?
This would be a great advantage for us, because we could use your same blood and harvest tissue from yourself instead of grafting it from other places. That is always more has a more mobility into what we do.
Great. Next question. I have two more. One, thank you so much. Our new professionals coming out of dental school are coming out with more debt than ever. They're coming into a different marketplace. What advice do you have for our new dental professionals?
Well, it's tough because I think the problem is that our profession is manual. You have to improve your dexterity, and you need to work. So you need to to have some fresh meat, in a sense, to really do things, you know. So if I would be a young dentist coming out from the university, I will try to go. I don't know if in the States you have franchises. In Spain, we have a lot of franchises.
Yes.
So I would go.
They're growing by evidently 3% per year.
There's a way to really be able to create your skill, no? Unfortunately.
So that's interesting that you would recommend that would be a good place to be. Yeah. Now you have some income, but what else would you do? Would you suggest?
This would be just the first step, no? To really to do something, and then I would recommend them to do master's degrees. You have the best master's degrees. You have the best education in the world. You know. You
take advantage of that.
Yeah, take advantage of the great teachers that this country has. That is tremendous. You know, you need to furnish your head. You know, with regard to how to face a case, how to face a situation. You know? And education is the only way that will provide you success in your career.
Another similar answer to Dr. Winter, who you know, right?
Yes, absolutely. Yeah. That's my teacher.
Yeah. Last question. I know you've only spent a half a day with us, but what is your perception of the Florida Academy of Cosmetic Dentistry, and how has your experience been with us?
Well, actually, when I saw Florida Cosmetic, the cosmetic word, once I came here, I didn't speak with anybody. I said, well, maybe it's more about composite, veneers, and bleaching, and I was really pleased to see that you have people that work in all different areas, that you are a really, really young academy. I saw a lot of young people, so
we're older than we look.
I really liked it because you know I see you really enthusiastic. I saw the new president, how enthusiastic he was to really come up with
Dr. Brian Olitsky. Yeah, he's
better education.
Did you like his outfit?
Absolutely. Well, sports and work is, you know, is what it means is the same values. Is an effort, you know. Is you want to run an Ironman, or if you want to do the type of dentistry that I showed, it's only effort. Is how much meat you want to put on the oven. You know?
Right.
It depends how much effort, how good you want to be. You know. So what I'm showing is, you know, I'm showing also what it takes to get to what you see. You know, is not coming, you know, out of the blue. It's just an effort to really willing to come up with something different and provide the best to your patients. So I think this academy has a great future. I think you did a great break, and only taking the people that are really interested. This, I think, is a major breakthrough.
Major change that we made to our organization. You think it was a good idea?
I think it's the best idea, because you basically are with people that are willing to go forward, and this will only make you bigger, definitely.
Wow, thanks. Yeah. Well, folks, again, we want to thank Dr. Gamborena from Spain for being with us and being gracious enough to sit here and answer my questions. Thank you so much.
Thank you very much. Pleasure.